But today is absolutely about how do you keep progress? How do you keep making progress when things are difficult or when you meet barriers that you hadn't anticipated? To set us up for what will be two rounds of sharing in groups, I just wanted to introduce you to, next slide, Matt, introduce you to an approach that actually was developed in business, but has been used by the Royal College of Physicians to look at trainee quality improvement programs and projects. And so I thought it would be useful before you go into your discussions this morning, just to have a different framework to think about when you come across either your own barrier or something grinds to a halt, you don't seem to be able to get through, or to help someone else think about what they might do when they've come across a barrier in their work. So what makes a successful project? Well, the hexagon diagram here, next button, Matt, please, shows that, it's pretty common sense that first of all, you have to have a good idea. The timing has to be right. You want the right people in the room. You need support, you need resources, and you need sustained leadership. And that all sounds very good. But as we also know, because we've worked on this ourselves, that we need to be clear about what it is we're trying to achieve, how we would know that the changes we've made are an improvement, and what ideas have we got to make an improvement, and then to actually put them into action, not just talk about them. Next slide, Matt. So these are some questions that you can ask yourself that have been correlated with being able to get projects not only on track, but back on track if they've come a little bit adrift. The first principle is that it's not the time it takes to complete, but it's the gap between reviewing whether or not you've made the progress that you would have liked to. So important things to think about, and all this is on one sheet of paper in your workbook. So just listen rather than try and make notes, and you'll have the workbook with you, page 3 in the workbook when you go to your meeting in a moment. First of all, reviewing with a senior sponsor, somebody like the medical director or the divisional director or a matron, at least every couple of months, if not more often, especially if you're doing some complex changes. Secondly, make sure that enough stakeholders are involved of what you're doing and the progress you're making or the problems you're having. And in our work, that might equally mean staff as much as it means families and perhaps your parent supporters groups. And make sure that each milestone is a progress stone, not, as they say in the phraseology, a standing stone. So make sure you are making progress, however small it is, and that's clear to everybody. As soon as things come to an absolute halt, something else needs to happen. Next slide. Staying true to the plan and the timescale. Now, if we've had a massive example of the challenge this can give, it's where we are at the moment, in the middle of a pandemic. So the issue for us and you almost certainly has been, how on earth do you keep your original plan to time when something comes like this comes massively out of the blue and is disruptive? Now, it's true that everybody's work will have slipped, but in the past, there may have been less dramatic problems for you. And so what they suggest is make sure you've got the right and necessary people involved at all times. Make sure people have got time to do the work. And if time is at a tremendous pressure, as it would have been in the last 6 months, is make the task a bit smaller and a little bit more achievable rather than keep to the original size of the task and expect people to squeeze it in to an overloaded day. It's progress, stepwise progress, that keeps everybody motivated and enthusiastic and able to make change. Is the team being well led, or has one of your leaders been seconded off to do something else? And if that's the case, then the team have to come back together and think about an alternative situation for the moment. And I know that will have happened in some of your teams during the pandemic, and may be about to happen again. So be prepared and be adaptive. And then lastly, have you discovered that you're missing some talents in your team that either you need to find in your organisation, perhaps through the quality improvement team, or that you need to put hands up and say who needs to go off and learn about this or read about this to see if we can use that skill set from our own team rather than having to bring it in from outside. But be honest about what talents you do and don't have and which ones you need. Next slide, Matt. Do you have visible backing from senior leaders and those involved in the change? Now, this, of course, is something that commonly happens in hospitals, is that people are distracted and busy and not paying attention to what you're doing because they have so many other things to pay attention to. But one brief corridor conversation from a medical or nursing leader, one comment from the comms team in the hospital about the work you're doing, all of these things are signs, not just to those you're working with, but to those who you would like to work with to overcome a barrier, that this is important. And yes, other stuff is going on, but this matters not just to you, but to other people in the organization with influence and power. Next point, do the leaders communicate with those changing what they do and support and challenge them? Now, in the old days, we would have done this through walkabouts in the hospital. I don't suppose those are so easily happening at the moment. But it is about you as individuals, and particularly those of you with a senior role in your team, to ask questions and pay attention and show people that this work still matters in spite of everything else. Those are the things that will encourage people and sometimes may prompt the answer to a question that suddenly overturns a barrier that was in your way. And then lastly on this slide, is everybody keen to participate? Now, almost certainly everybody is becoming rather exhausted from the current situation. And that's where keeping the project in people's sights, in posters, in conversations, and displaying and demonstrating, even if it's only small steps, the progress that has been made is really, really vital. Change and improvement is truly motivating if you can achieve it. And so managing that and showing it is really important in keeping people on side. So before you go off into your groups, and Matt will explain about that in a moment, if you could just bring the next slide up. So is there enough effort and energy being put into the work to learn, change and sustain the gain? So this is a really key point at the moment. Nobody will mind if the progress you're making slows down a little bit in the coming months, or indeed has done already. But everybody will be sad and disappointed, and the patients will not gain what they could have done if we stop completely. So what we have to do is find ways round the barriers and ways to overcome the problems that we see. And almost certainly, all of you will have experienced some, and some of you will have experienced one that's just about to come up in somebody else's situation. So I think the next 2 sessions where we're sharing these will be very, very useful to you to realize you're not alone, but use them positively and just check on these questions plus many others to see whether you can help each other find a way around them. Now you'll see on the next slide that as is often the case with these management ideas, it all gets a bit technical with scores for, are you in a winning project? Should you be worried? Or is this woeful and it's never going to get anywhere? Now I've put them up here because I know some people like to see the way categories evolve, but I'm not asking you to use the numbers. But if you come across some things that would be red in this approach, then they need addressing pretty quickly. If they are things in the yellow zone, you may be able to spend a week or 2 working out the best approach. So use it as a way of prioritizing your next steps and your conversations, rather than absolutely sticking to the score and the red, amber, green approach. That was one of the comments in this original paper. And indeed, the Royal College of Physicians used this approach when they were looking at trainee QI projects.